Is it similar to cervical dysplasia in that many people clear these infections that are never really symptomatic?
So we actually are completing a natural history study with the longest natural history data for oral HPV infection. And so what we have found is that there are some similarities with cervical HPV infection. Most people do clear their infection. Within a year and a half, most people will clear their infection. But at 7 years follow-up, 25% of patients in this cohort still had an HPV infection. I shouldn't say patients, healthy individuals with oral HPV infection still had a persistent infection at that time point. So there are many similarities, but it's still a burgeoning field, and that's what we're trying to understand is what factors would lead to someone clearing their infections and what factors lead to persistent infection. We believe that persistent infection is really equivalent of microscopic disease, and in this natural history study we did identify one case of HPV-related oropharynx cancer. And so there are similarities, but not enough that we can screen for oral HPV the same way that we can screen with cervical HPV, where it's an early marker of cervical precancer or cancers.
Yeah, I think it's a really important point that Carol makes. I mean, you know, the virus is very common. People get exposed. I mean, in women for cervical exposure, it's probably 80% or so. The vast majority of people who are sexually active get exposed, but the vast majority of people clear the virus, probably because of the immune system being able to handle this. And for some reason that we don't fully understand, some patients are not able to clear it. And I think screening for cervical cancer is extremely successful. However, for head and neck cancer, right now we don't have a standard of care to screen, and Carol has led the way and with a study to actually try to establish these type of methods to screen early on to see if patients or people, healthy individuals, are not able to clear it and maybe develop cancer, and then potentially also maybe an opportunity to intervene early.
So while everyone is exposed to the infection, very few people actually get an oral HPV infection. So when you test healthy people in the United States, 1% will actually have an oral HPV infection. So although most people are exposed orally to an HPV infection, very few people will actually have that infection when you test them, and even fewer, well, not just persistent, have an infection, right? So 1% will have an HPV-16 infection. Most of those people will go on to clear it. Very few of them will go on to have a persistent infection, and even fewer of those will go on to develop a cancer from that persistent infection, right? So the numbers kind of dwindle, and it is a relatively rare cancer.